Okay, I'm going to go ahead and take you through a quick tour of the genitourinary system, which includes diseases of the kidneys, male genitalia, and female genitalia. If you just go through the tabular index, you'll see that it begins out with nephritis, nephrotic syndrome, and nephrosis, which basically has anything to do with the kidneys. That goes from the 580 all the way through until 589, and then it goes into other diseases of the urinary system, and that goes from 590 into 599. At 600 we start talking about diseases of the male genital organs. We start with the prostate, 600, and in 601 and 602. In 603 we start talking about the testes, and 604 and 605. 606 is male infertility. 607 is diseases and disorders of the penis. 608 is the other disorders. Could be any number of things. And then we move into the female genitalia. Breasts are 610 through 612. And then inflammatory diseases of female pelvic organs are 614 to 616. And then we get other disorders of the female genital tract, which are 617 to 629. Obviously the largest. It starts with endometriosis, and then prolapse. Other diseases that you go through. 621 talks about diseases of the uterus. 622 is non-inflammatory diseases of the cervix. And then vaginal diseases starting in 623. Infertility in 628, and then 629 is kind of other diseases as done. I've set up 5 examples rather than using the online, which I feel was kind of a disappointment. I've actually hand copied a lot of the alphabetical index, so you can kind of see how I would look these up and follow my thought process as a coder and then kind of follow along. So the first one is pelvic inflammatory disease. Now the easiest way to look these up that I've found in the alphabetical index is just go backwards. So if I will start with disease and then go to either inflammatory or pelvic, depending on which one I find first, and then whatever's left I'll usually go there. So to see how that works, I look up disease, and then I looked under inflammatory, didn't find anything, so then I go to pelvis, and there's inflammatory female PID, which is the abbreviation for pelvic inflammatory disease. Now you would say, okay, well now I can stop because I've got my 614.9. It's pretty obvious this, but you always want to make sure, because underneath PID you've got this little with statement, and then you've got these 3 things that it could be. Now, just in looking at these 3 things, it's not mentioned in the problem, so you don't assume that it's there. So the PID code, this 614.9, is the right code. Then I would look it up in the tabular index, confirm it, make sure there's no exclusions that would apply to my particular disease. Hematuria, which is blood in the urine. Obviously enough, I would start with hematuria. Now, this is benign, essential, idiopathic. You'd think, okay, maybe I can stop here. But again, you always have to look and make sure, because you've got all these due tos, endemic, gross hematuria, which is you can see the blood, intermittent, which means it's on and off, microscopic, which means you actually have to do a urinalysis to see it, but it's not visible to the naked eye. We're not given any of that. We're just given hematuria, so we go with this code 599.70, and again, look that up in the tabular index, make sure there's nothing in the problem that would say, okay, you can't use it for this particular scenario. Acute and chronic pyelonephritis. Looks like we've got 2 conditions. When I first looked at this, I thought, okay, maybe this is like a combination code, which would really be unusual, but I put nothing past the ICD-9 book. Anything is possible. Look under pyelonephritis. It says see also pyelitis. Now, sometimes you will go directly there if there's nothing underneath of it. Other times you'll look under this particular entry, and then if you don't find what you're looking for, then you go to pyelitis. So we're going to have to look further and dig a little deeper. Okay, I've got acute, chronic, and syphilitic. So it looks like I've already got my acute and my chronic. There's some other things underneath acute with renal medullary necrosis, which is not indicated in the problem. So acute would be 590.10, chronic would be 590.00. Now, just a quick note, if we're given two conditions, notice here that we don't have any secondary to or due to or anything like that. You'll always want to put it either in the order that it's there or put the acute before the chronic. It's just something to kind of keep in mind. You'll rarely come across it, but just in case it does. Benign prostatic hypertrophy. This is something actually that I see a lot of. It's a precursor, or could be a indication or symptom of prostate cancer. So it is a big, huge deal in the medical world. I see it come across my desk fairly frequently. I would say probably maybe off the top of my head 3 or 4 times this week. So then what's the first term? Again, going backwards, hypertrophy. Okay, easy. Then whatever the body part is would be prostatic, sure enough, under prostate. And then under that I find benign. Now there are some other things that are underneath that with, I've got other LUTs, which is lower urinary tract symptoms, and then also with urinary obstruction or with urinary retention. Kind of a little rabbit trail here. You kind of look at that with urinary obstruction and with urinary retention, and you think, well, why don't they have 2 separate codes for that? They just don't. That has been why the push to ICD-10 has been such a big deal, because things like these are much more specific. For example, if I just have pain in the lower limb, well, there's only one code for that. In ICD-10, I got a draft book last week and I was looking through it, and they've actually broken that code, the pain in lower limb, which could be right or left or both. They've divided it down into pain in posterior right limb, lower posterior right limb, pain in lower anterior right limb, pain in left posterior left limb, and pain in left posterior limb. So you have much more codes to work with to say not just that it's in both legs, but that it's actually at the front of the leg on one and the back of the leg at the other, if that's what's indicated in the chart. I haven't looked it up, but it is possible that urinary obstruction and urinary retention are 2 separate codes now. So just to keep in mind that as frustrating as ICD-9 is, it does serve a purpose, but people's complaint is very similar to what's been seen on the forums. It's just too generic, which is why the big push to ICD-10. We will be reading a chapter on ICD-10, and if we get a chance to ever meet up, let me know. I'll bring the book, and just so you can kind of look through it and see how densely packed the book is, and just how many new codes there are. Okay, enough of that. Last problem, fibrocystic breast disease. So following the pattern, I'm going to look under disease, and then breast. I've got breast disease right off the bat, 611.9, but there might be something that actually specifically says fibrocystic. Fibrocystic, I spelled that wrong. And then these are most of the things that were under breast. I've got cystic, which is closer, but then I've got here fibrocystic, 610.9. If I just stop here without looking underneath of it, I would have missed the correct code. Some of the other things, inflammatory breast disease, Paget's breast disease, these M codes you don't have to worry about unless you're specifically dealing with a cancer with oncology, because this is actually a tumor registry. So I put some other things from the index in here just to highlight some things. Puerperal, postpartum, not otherwise classified, 67.6.3. This little checkbox, remember that means you need to check for a 5th digit. You can't just go off of what's in the index. That's why you always want to check the tabular index. And then just to highlight it a little bit, I noticed that sometimes when people, when you guys are writing down the answers, you'll write NEC 611.89. The NEC code does not go with the ICD-9 code. It actually goes with the description. So it's actually like specified NEC, and then the code for that is 611.89. So I hope these examples help. The GU is much smaller than digestive, so I'm hoping there's far less confusion. Plus, I'm hoping to help you guys get quicker access through the alphabetic index and using the tabular index just to quickly verify that no, there's nothing else that is going to mess me up if I use this code. Any questions, you know how to get a hold of me, and I'll try to answer them as quickly as I can.